Hi there, welcome back to our video series where we dive into the ins and outs of facial plastic surgery. Today we're talking about how to prepare for the recovery process of a rhinoplasty. I want to make sure you're well prepared for the journey ahead. Let's get started. Alright, let's move on to a rhinoplasty, or as most of us call it, a nose job. Here's what to expect. Initial swelling and bruising. Swelling and bruising around your nose, eyes, and even cheeks is totally normal. It will gradually improve over the first few weeks. This is typically the worst around day 3 after surgery. Expect nasal congestion. You might feel like you have a stuffy nose and may not be able to breathe. That's just the internal swelling, and that will get better with time. There's also gradual improvement. So initial recovery takes a few weeks, but remember, the final results can take up to a year to fully show. Let's get into the immediate post-surgery care. You're going to have follow-up appointments, so make sure you follow the instructions. This may sound like common sense, but follow your surgeon's instructions to the letter. They really know their stuff. You're going to need rest and elevation as well. Keep your head elevated to help reduce swelling and promote healing. We recommend a 45-degree angle to keep your head above your heart. A recliner or extra pillows under your back and neck can help you stay comfortable. You'll also need some cold compresses. Apply cold compresses over your eyes, on your cheeks, and around your nose. They're great for reducing swelling and discomfort, but be sure not to rest the ice directly on your nose and to only ice for about 10 to 15 minutes at a time to avoid compromising blood flow. Dealing with pain and discomfort? Here are some pain tips. With your pain medication, take it as prescribed and directed. The medicine is there to help. You can alternate your pain medication with extra strength Tylenol, but be sure not to exceed 4,000 milligrams per day of acetaminophen. Cold compresses or ice to the surrounding areas of your nose to reduce swelling. Do not touch your actual nose, but this can be a real lifesaver. Nasal saline. You also will need to get a few bottles of nasal saline to rinse out your nose. You will use this at least every 2 hours while you're awake. This will keep the inside of your nose hydrated, flushed out, and stop bloody, crusty boogers from forming and drying in your nose. Rest and relaxation. Get plenty of rest and avoid activities that could increase your blood pressure and cause pain. Take it easy and let your body have time to recover. Swelling and bruising. Let's break it down. So the initial swelling peaks within the first 2 to 3 days and then gradually decreases over the following weeks. It's common for your cheeks to swell like a chipmunk, so don't be surprised if that happens. Or if you get bruising, which you can have black eyes. Bruising around the eyes can last for about 2 weeks. The worst of it will fade after the first week. Long-term swelling. Minor swelling might stick around for a few months, especially at the tip of your nose. Here's your guide to getting back to normal. The initial rest period. Take it easy and take at least 1 to 2 weeks off of work. Your body needs this time to recover, and you will definitely look swollen and bruised at first. Gradual resumption of your activities. You can slowly get back to normal activities around 2 to 3 weeks. Avoid strenuous activities and heavy lifting for at least 4 to 6 weeks. And protect your nose. Stay away from activities that could risk trauma to your nose. No high-impact sports for several months. Are there specific dietary recommendations or restrictions that I should follow to aid in my recovery? What you eat can make a big difference in your recovery. You'll want to stick with soft foods to help minimize the movement of your upper lip. No crunchy snacks for now. Staying hydrated. Make sure you drink plenty of water. Hydration is key for healing. And avoid alcohol and caffeine. You'll want to limit your alcohol and caffeine intake as they can contribute to swelling and dehydration. Follow-ups are crucial, and here's why. They are critical for your recovery. These appointments help monitor your healing and can catch any issues early on. You'll have regular check-ins with your doctor. Expect several visits in the first few months to assess your progress. They also help with adjustment and guidance. Your surgeon might adjust your care plan based on your own personalized recovery. Knowing when to call your surgeon is important. Severe pain or swelling. If you experience severe pain, excessive swelling, or any signs of infection like redness and fever, contact your surgeon immediately. Any unusual bleeding as well. So bleeding is normal. Blood can even drip down into your throat, but significant or prolonged bleeding is a red flag. You'll want to seek medical attention right away. If you have breathing issues, persistent difficulty breathing or nasal congestion should be reported to your surgeon. It's normal to feel congested at first, but if it lasts longer than expected, let your doctor know. Patience is key with a rhinoplasty. You'll see gradual results. So while you'll notice changes within a few weeks, the final results can take up to a year to fully develop. Your nose will fine-tune over time, especially the tip. Keep your nose protected from the sun. So limit sun exposure with sunscreen and a hat. If you had an open rhinoplasty, which means that you have a scar under your nostrils and the columella, cover this area with a silicone-based scar gel at night and then sunscreen during the day if you go outside to help protect the healing scar. And always follow your surgeon's advice. Stick to the long-term care recommendations from your surgeon to keep your results looking great. And that's our detailed look at recovering from a rhinoplasty. Every recovery is different, so it's essential to follow your surgeon's guidance and be patient with your healing. It takes time. Thanks for watching.